And welcome to our first edition of Nesha Talks, the platform where you get a free consultation, and who better to ask than our resident doctor. That's none other than Dr. Nelson Makemba. Welcome.
Thank you very much, and we are excited to be here.
Great to be here.
Yeah.
This is a platform that Nesha created so that we can ask questions, we can speak, and we can have those uncomfortable conversations at times.
Definitely, that's right.
So today it's all about heart attacks, the ins and outs, the did you knows, and most importantly, prevention is better than cure.
Yeah.
So Doc, maybe let's put in perspective, how common are heart attacks?
Heart attacks are very common, even in our settings. It's actually one of those things that at times they actually, are underdiagnosed. That's why a lot of people might actually end up losing their life and not even knowing that they have actually suffered a heart attack. Mm-hmm. So it's something that we commonly see in our settings, and that's also one of the reasons we decided to have this talk, just so that we can, discuss and go into details as to what it is and how it presents itself, so people are able to pick it up.
Great. And many times, like Doc said, it's for us to educate ourselves so that we can prevent it from happening. Yeah. Are there ways that we could prevent a heart attack? Yes or no?
Yes, there are a lot of ways that you can actually.
And how?
If you look at why people develop heart attack, for instance, it's because probably they don't exercise enough, they live a sedentary lifestyle. So exercise is advocated for. Losing weight and maintaining a desirable weight. When your body mass index goes up a little bit and you somehow obese, that increases the risk of developing heart attack. Losing weight and maintaining a desirable, weight is probably advocated for. Staying away from all forms of cigarettes. If you ask any doctor, a cardiologist, what is the one thing you will advise a person not to do to safeguard their heart? Don't smoke, whatever that is, be it cigarette, herbally, whatever. Don't smoke at all. Mm-hmm. Quitting smoking has been advocated for. Just eating a healthy, balanced diet, where you're not, having cholesterol building up in your system, has also been advocated for. Managing the stresses, stress also can somewhat tip you over. So being able to talk about challenges, and if you are in a difficult position, talking to a healthcare provider, going for, psychological sessions just to, vent and make sure you get things off your chest is quite a good one, actually. And then staying away from alcohol, especially, and if one does drink in moderation at least, that also has been advocated for. And one thing that we also tell our clients is just to make sure that you go for your yearly checkup. If you are younger, at least one every 12 months, or that's once a year. If you're a little bit older, particularly if you're age 40 and above, we can then, say, probably try to check yourself out at least every 6 months.
Okay. Yeah. All right. And many times you could have an instance where somebody says, my father, had a heart attack, my, grandfather. Sometimes it's in the bloodline. Yeah. Is it genetically inherited?
I would not necessarily say genetically inherited, but some of the predisposing factors, such as high blood pressure, there has been a familial component to that. So if your people of your bloodline have high blood pressure issues, and that's what tips them over to end up getting heart attack, yes, indeed, if you do get high blood pressure, that then might predisposes you to end up with a heart attack. And even the ability just to physiologically digest, some of the food we eat, the cholesterol buildup issue. Some people, they might have, a propensity to having their cholesterol shooting up a little bit higher compared to others. So if you've got those genetic variation that comes out at play, then eventually, the complication thereof becomes a heart attack. But heart attack in itself as a nutshell is not necessarily genetically transferred. Yeah.
All right. But lifestyle, like Doc said, try to have a healthier lifestyle as well, and the smoking, etc. Yeah. For someone that has a heart attack, somebody probably had a heart attack without them even noticing. Yeah. What are some of the signs that you are about to have one?
When you experience chest pain, we call it retrosternal chest pain, just a chest pain behind your breastbone. It's mainly toward the left of your chest as well, because that's where the heart is sitting. This pain might radiate into your neck, into your jaw. It might go to the left elbow as well. And also particularly with the ladies, we do see sometimes they only have an epigastric pain. So that's a kind of cardinal, picture that you might be looking at. And oftentimes when this pain kicks in, it might be associated with shortness of breath. where an individual is having difficulty breathing while they're experiencing this pain. And if you factor that in, especially if somebody is a little bit older, men age 45 or older, women 55 years or older, or if there's a background of high blood pressure, maybe cholesterol issues and diabetes, or maybe the individual is a bit obese, those might be telltale signs that might be a pointer to the fact that there could be something happening and you need to get to the hospital facility as soon as possible.
And let's talk about those around us. Many times we need to educate those around us on what to do. So often somebody dies because they needed the necessary attention. So if somebody is about to get a heart attack or is experiencing it, what can I do if I'm around, and how can I help that person?
What I always tell my patients and their loved one or family members is to say, if, for instance, we are suspecting that an individual is experiencing a heart attack, the first thing that you want to do is pick up that phone, dial that emergency number, get the ambulance to the site, the house where you guys are seated, so that there's an emergency healthcare provider on site. And then once the healthcare provider or the ambulance arrives, they then get the patient in the ambulance. They might give some of the emergency drugs that might help make sure the patient is well oxygenated and ferry them to the hospital as soon as possible. If you have an aspirin at home, that might also be advocated for. Okay. Make sure that you sit the person up, in an upright, prone position. Make sure that the room is well ventilated as you are waiting for the emergency to arrive. But the first point of call, if you are having a loved one that you think they might be experiencing a heart attack, the first thing you do is you call for help. Dial that emergency number wherever you find yourself, whatever city the kind of emergency services are available to, and give your direction so that these people can arrive on time.
Time is of essence.
Time is of essence, yeah, definitely.
Every second counts.
Every second counts.
As we wrap up, Doc, for somebody that's experienced heart attacks, what is the process after that? How do you treat someone with a heart attack? Is it very easy for them to get another heart attack after that as well?
It's actually a good question that you asked. First and foremost, we know that if you experience a first heart attack, and there are risk factors, maybe got a blood pressure, got a cholesterol problem, or even have diabetes, there's actually a chance you can actually get a second heart attack. And the rule of thumb really is you might survive your second heart attack. The second one, your chances are markedly diminished. Individuals that experience a third attack oftentimes don't make it. So is that very serious? And therefore, the aspect of managing those risk factors is very important. What we do, for instance, in an emergency unit or a casualty, if a person arrives with a suspected heart attack, we do put those probes on their chest, connected to a machine called an electrocardiogram, which is an ECG. It sort of print out a graph. We are able to interpret the patterns and pick up, the patterns that are inconsistent, that are consistent with the presence of a heart attack. We also draw some blood. We send them off to the laboratory. We do what we call cardiac enzyme. They are just markers that we tend to look in the blood that can get elevated. And then, there are quite a whole lot of medications that we give, to these patients. And oftentimes we admit them to a high care unit where they are monitored closely over 24 hours. We probably are going to involve a cardiologist, which is a doctor that specializes in managing, problems that are heart related. And then, when the person, make it on time to the facility, oftentimes, they tend to live. One of the other aspects really that tends to also happen with heart attack, I'm sure we all have heard of people dying in their sleep. The reason why that oftentimes happens, especially people with high blood pressure, if you are not taking the medication as prescribed, or maybe the medication that you are not taking is not necessarily the best of medication, because medications have half-life. If you are on monotherapy, meaning you're just on one drug, if the half-life of that tablet is 8 hours and you drink your tablets in the morning before you go to work, the likelihood is that by the time you get home in the afternoon, the strength of the drug to control your blood pressure has somehow sort of, weakened in the system. So when you go to bed at night, then you got these spikes of blood pressures in the early morning hours while you're in your sleep. And if a heart attack gets you while you're in your sleep, you might not even feel anything. That's why you find a lot of people die in their sleep, particularly in the early morning hours. But the medical fraternity is also a little bit smart. We are now getting what we call fixed dose combination drugs, where you got an ingredient of 2 drugs in one pill, where we're able to at least give you that 24-hour cover, so that when you are in your sleep, your blood pressure still is, maintained and controlled, and the strength of the drugs in your system are actually working. Yeah. So the idea really also is for our people to just make sure they follow instruction, religiously take their medication as prescribed by their doctors. Yeah.
And not overdoses
As
well
definitely.
in that either.
Yeah.
Doc, thank you. We appreciate you so much and just educating the public at large. Any final concluding remarks?
Well, I want to say to those that are engaging us is that, heart attacks is quite a serious concern in our setting and even in the first world countries. The idea really is, try to manage those risk factors. Lose that weight, maintain a desirable weight, make sure that you quit smoking, make sure that you eat a healthy, balanced diet, rest very well, get, to be well hydrated. And when you're going through the pressures of life, always have a friend, a confidant where you can confide in. Go to somebody and vent. If you don't seem to have that person in your vicinity, book yourself with your doctors, go see a psychologist. Just make sure that those stresses are managed as well. And if you do this, the likelihood is that you're going to keep the risk of getting a heart attack and pain.
All right.
Yeah.
My doctor said no stress allowed, and I will continue saying that. Doc, thank you so much.
Thank you very much.
So there you have it when it comes to Nesha Medical Practice. Nesha Talks. Join us again. That's next month with another suggested topic as well. Please put your comments on the feed. You can DM us on the online platforms, and we look forward to seeing you next time.